That's the only one. Okay.
All right, let's go ahead and get started. It's written call to order this Employee Benefit Trust Workshop for August 6th, 2026. Let's start off. Are there any public comments, ma'am?
Yes, sir.
Questions? Before we begin, I want to commend staff and the consultants for coming together to try to create a workable solution to a problem that faces not only our city, but every city across the nation, every organization across the nation. There are merits and there are problems with any solution offered, and that's what we're here to talk about this morning. Mr. S.
Yes, sir. Thank you, Mayor, Council. I echo that. Staff has spent countless hours, on this and really tried to figure out how to come up with a solution, for a very demanding problem. Before we dive into this, Mayor, I would like to, I think y'all know Todd. He's with the Valera Group. He's our consultant. We have some folks here from Kempton, which if Council chooses to go down this path on August 11th, then they would be our third-party administrator. And so there were some folks that were able to come in and wanted Todd to just briefly introduce them, and then we can move on.
Meet you.
First of all, we have Merrick Matthews and we have Meg Freeman. I'm not sure your whole title, Executive Director, and then a bunch after that, Executive Director of Trust Operations and Development, because I work for her, basically what it boils down to. And Meg is the implementation coordinator, so she is going to basically be overseeing the transition. So we wanted to have them there since they were here, since they were in the area. In case you all had any questions about how that procedure works or how they function. If you're not familiar with the self-funded world, you may not have heard of Tempton. They don't need the same recognition as Blue Cross and Shield or URIC. But in my opinion, they're going to be head and shoulders much easier to work with the Blue Cross and Shield. So if you have any questions of them, as we go through this, that's what
and they won't be able to be here on the 11th, so want to at least introduce them here. If y'all do have any questions between now and the 11th, please send us those questions. We'll make sure we get those answered from Kempton and kind of go from there as we navigate this decision. Otherwise, the reason why I wanted to do this employee benefit trust was, one, kind of just give some very, very, very brief and quick updates and address any questions that y'all do have from previous till now. And really the more important side of it is to show y'all plan design and to show you how much it's going to cost our employees, so they get it before the 11th or next week. So in the handout, this is going to be the smallest slide deck y'all are going to have all day. So when we look at the self-funded proposed plan design, you'll see on the left column the PPO Copay plan and then the PPO HSA plan. We also put in front of you the medical fully insured highlighted Blue Cross Blue Shield renewal. We're only showing you this one to show the comparison of the plan design itself. Of the plan design itself, and to show where the deductibles and the out-of-pockets and everything either match up or don't match up. Obviously, HSA is not a current plan design that we have, so you will not see that on there, but you'll be able to see the side-by-side comparison. So the important thing to note on here, the copay plan, for the most part, is we were able to lower the deductible from the buy-up plan from $4,500 to $4,000. The out-of-pocket for in-network is $8,000. And then $8,000 for the family and respective out-of-pocket. The copays, we pretty much were able to keep almost all the same or relatively close. The biggest change that you will see is we went from $500 on the emergency department to $1,000 on the emergency department. There is an educational component to that. This gives us some opportunity to really dive into the educational side of healthcare, to show people, what the emergency room is actually used for versus what we typically see a lot of folks use it. That would probably be one of the bigger, let's call it, hit to the pocketbook if you decide to go to the emergency room. But again, if it's life, limb, or eyesight, it is absolutely worth it. And then on the HSA plan, obviously we could talk more about that here in a minute. How it's funded is a little bit different, or how the claims are paid are a little bit The other thing that you'll notice on the pharmacy services, we were able to lower the generic cost, the cost for generic meds down to $5, which originally it was $15. And then the increase was in specialty and some mail order. So we did the specialty brand name. There's a whole bunch of different, versions of it, but basically the brand name, high dollar drugs, you can still get them. As we said, there's not going to be much change. However, it's going to be $250 for the copay for those. However, there are tools and resources such as, and we're going to be using TrueScript, which is a great pharmacy benefit manager that navigates between a good transition between fully insured and self-insured plans. And so there's opportunity where they can get some of these drugs at no cost to the employee or a reduced cost to the employee by using other resources that they have available. So we're not taking away what they currently can do. However, they're going to pay for it, but there are other resources that they can do that can also save some money. Those are I'd say the big changes on the copay plan. It is still an 80-20 coinsurance, except for I think on some of the complex imaging. But we try to keep everything very similar to market. Yes, on the out-of-network cost, you can see those costs are going up pretty significantly. We are trying to encourage people not to use out-of-network, and if they do, we encourage them to reach out to Kempton, our TPA, to really try to find some better options on how to navigate some of the more complex and more expensive healthcare options if they should be out-of-network. On the HSA plan, typically, this is a true HDHP HSA plan. They do cost the cities less money typically, which is where you're able to get some, not just savings for the city, but also savings for the employee to a certain extent. You'll notice that the deductible is $6,000 instead of the $4,000 on the copay plan. However, once you hit your deductible, you hit your out-of-pocket, and that's traditional, and that's what you typically see with a true or good HSA plan. Once you hit your out-of-pocket, you're done. The liability, in a way, gets put more onto the employee and their families. They're paying for those costs, when they go to it. But everything that they pay for, from pharmacy to going to the doctor to visits to specialty, whatever, all apply to the deductible and to the out-of-pocket. Whereas a copay plan, you could go to the doctor 10 times, pay $40, and none of that hits your deductible. So copays do not apply to the deductible or to your out-of-pocket. So just kind of side-by-side comparison, if you have a catastrophic year, a bad year, and you do reach your out-of-pocket under the PPO plan, on an individual, you'll pay $8,000. On a family, you'll pay $16,000. And on the HSA for an individual, your out-of-pocket would be $6,000 and $12,000 for the family, respectively. All of the in-network benefits, again, this is common for HSA plans. You're pretty much paying for, in a way, it's kind of the cash price. It just applies to your deductible. But again, Kempton can help navigate some of that stuff as well to find the best rates or the best programs. The one big benefit that we were able to do, because we're able to save the cost to the city on this, is we're able to give back to the employee and to the family slightly. So under this plan, we're going to propose a $500 HSA, basically cash onto the HSA card on the employee only side. And then on the family side, they would also get a $500, call it a stipend, but onto the HSA card. The HSA card is not a flexible spending account. It is a health savings account. So it stays with you for as long as you want. And you can let it grow, you can contribute to that, and it's not use it or lose it like the flexible spending accounts on typical PPO sites. Any questions on the plan design itself before we dive into the pay side of it? So we were able to improve the benefits pretty significantly compared to the buy-up plan. So the buy-up plan is what we're comparing the copay plan to. We were able to reduce some of the deductibles and stuff down. The HMO plan, I believe, on here it shows that the HMO, it was $4,500, but the out-of-pocket was a little bit higher.
Any questions on questions?
So on the next page, a lot of stuff on here. Left side is our current employee and city contributions for each buy down or HMO plan preferred in the buy up. The right side of the page is the self-funded HSA, the PPO, and the self-funded copay plan. So if you go into the employee monthly contribution, it's about 4 columns over, you can compare each side onto what the employee is paying. So on the PPO HSA side, they're currently paying for, we'll call it a similar, which again, it's not similar to the HSA. They'd be paying $410 a month for the family. I'm going to focus on the family side because that's the higher dollar amount. $410 for the family versus $384. So that's a 7% increase. We were, instead of the 12, we were able to get it down to 7% on the HSA plan. Under the, even though it's side by side with the PPO preferred and the self-funded, that was kind of our starting point. You'll see that it went from 472 to 535. Our goal was to keep the copay plan at 10% increase instead of the 12% increase. For the most part, we were able to accomplish that. If you look at the 4 boxes in blue, you'll see the city contribution percentage at 51% and 66% on the left side of the page. We put that, and what we did was we leveled that out before we applied the 10%. So we leveled it out, which made it 50% and 65%, which is a slightly higher than a 10% increase, but we wanted to level it out to have a good starting point where all of the city contributions for dependent coverage remained level or flat, if you will. Either way, the 535.33 on the employee monthly contributions is actually less than the 546 on the buy-up PPO plan.
Bottom left.
On the bottom left. Yes. Thank you, Kim. You'll kind of notice that between the HSA and the copay plan, city contributions, again, we kept those the same from last year. That was a big thing that we wanted to do on dependent coverage. So on the HSA plan, it's 100% for the employee, 55% for spouse, 75% for children, 70% for family. And on the PPO, it's 100%, 50%, 70%, and 65%. So basically a 5% decrease, which actually is the exact same or darn close to it from last year's preferred PPO plan. Outside of that, this is the first time that y'all and our teams are going to be able to see what it's going to cost them, what we're proposing for council to vote on, should y'all decide to go the self-funded route next week. We did not want to provide the Blue Cross Blue Shield renewals or the United Healthcare renewals because those are going to be 32% or 31.7%, 23% respectively. So those numbers were pretty easy. With that, I will take questions.
I have just simple question, really. So we have 311 employees listed here. What is our current number of employees on the ends? Yeah, 347, but that's the number of employees we have enrolled right now.
Yeah, so we're just going off of the currently enrolled side. When we build the budgets and stuff out, we go off of budgeted positions, even if they are big.
And that fluctuates basically daily.
Yeah.
Yeah. The vacancies, and then we have people that are in their transition of their hires if they aren't eligible for insurance until the beginning of the month. So does it make a difference if you have more employees? Like, is there a break whenever you get to a point, or is it actually? Well, yeah, probably when you get like to 1,000 employees or something like that. But our total base is around 682 with employees and their dependents.
Yeah.
Right. Thank you. When speaking with employees, what was you should roll feedback? Some of the questions.
Yeah, no, Mayor and Council, if y'all are okay with it, I would like to put some of the directors in the hot seat on this. If you want to share y'all's experiences from what y'all are hearing from y'all's team, so that way y'all are hearing directly from the folks that are on the ground. Start with Drew.
So development services, we do have a few employees that are not, we do have a few employees, their providers are not under healthcare highways. I know they've reached out to HR for you guys to look into, but obviously the cheaper cost was the bigger thing. So looking forward to that.
So overall, happy.
Yes.
David?
Yeah, so in public works, we haven't had any major concerns that have been brought forward to us. I think folks just wanting to get more education on what we can use on our part to help out. But Grace, have you heard anything or?
No, we haven't. No, just like you had said, yeah, just more education.
Yeah, but I heard he can make just so we've emphasized for staff to please let us know if there's any concerns, even if it's individual scenarios they want to look at. Visit with HR so to kind of create that. We haven't heard anything you may be concerned. From provider, the same. We had them, I guess, the meeting last week made it mandatory for all on-duty personnel to attend. Yep, the Dalton Rice kindergarten command staff meeting. The feedback there, overall positive feedback for where we're going.
No negative from our people. A lot of questions. Obviously, it's a new style of planning, so you're going to get those questions. I think one of the things that has been notable is how well kind of the presentations were received. It certainly helped to get advance notice and early information out to our folks, and so that's been well received from our folks. That's about it.
To echo what the other directors have said, my group is very impressed with the amount of concern from the administrative staff towards this issue in pivoting. To be fair, I've been a big advocate for a system like this. This is what I came from, and we pivoted. 2017, 2018. I was just telling Jacob right after I had my last kid, and it would work well there. This is a good system, and we've tried to allay any fears that our folks have had, and they've been minimal because I think it's been well communicated. So,
and pretty much same as what Drew said. A lot of questions, but overall, the cheaper plan has been kind of resounding effort that we hear through a lot of folks. Honestly, but
Toby. Yeah, I have nothing else to add. I know we had some small issues with prescription coverage, and we've been working through that with some prescriptions that were medically necessary, and so sourcing those I think was a concern. And then a couple of providers that aren't fine yet. We're still working with that and just trying to educate staff best we can.
Yeah, for the IT team is the same. It's the Q&A sessions last week were very helpful. Everyone went. I think they're appreciative of that. We're not paying that 32%. We're looking at other options. That's again not the 32%, but our team is aware of the state of health, high care, that it's just not pretty out there. So they're just happy to go through this exercise and get something that again is not 32% in case.
true.
Kim, Michael, you'll have anything you want to add to that?
Everything that my staff just told you is what right. I think change is hard, right? It scares people. And we try to say we're doing everything we can, but especially Dalton, Kim, and Maya and their teams have been working really hard on getting this across and explaining this to everybody. So it's been very helpful just to have that communication. Please don't be offended. This is all, a racket of paper machinations in my mind. We can't fix it because we're not federal legislators, and so the advocacy, I think my conversation with staff has been, when you vote for somebody, ask that question. That's one of the single biggest determining factors of our budget. And you all have little to no control over how that gets implemented, and I'm proud that we're here talking about it today, and I think it shows a lot of concern for the staff facility.
Yeah, I'll echo that too. I'm glad that we've been able to have the multiple meetings, the July 14th, and then this one, and then we'll have another one next Tuesday. We had 5 meetings with all employees last week. I think we had more than 2/3 of the entire staff that attended those meetings. So I think all went well. Questions were answered. We're getting a lot of feedback from employees to HR. HR is making notes and has a spreadsheet of all that stuff, all of that feedback that they're giving to Todd, and Todd's sharing that with Meg and Merrick, and we're all working together to get everything situated to where it doesn't minimal impact or zero impact on employees. Way to do it.
Thank you all. Thank you, everybody. And, one of the words that kind of came up, and so I want to, provide some clarity and some context, cheaper came up. And I want to make sure that council knows, and of course our staff knows, that change is hard. They have yet to see, the benefit. Obviously there's some unknowns that we're going through. Kimden, Todd, Alara Group have really done and put boots on the ground to really try to address these issues and either get providers on board or not. Again, this is not a skinny network. We're not making it cheaper at the cost of the benefits to our employees. And that's, I think, the most important thing is we are trying to enhance those benefits the best we can, where the impact is we'll call it as minimal as possible. We know there's going to be obstacles. We know it's not going to be perfect. We know it's going to take a couple of years to really truly implement and see the benefit, for our team, for their families, for the community, for the providers. But I'm confident that we will work through that and we can do that in the least painful way as possible.
Does that bear okay? Questions on the weeding?
I will. I just want to say thank you to yourself and Kim and Michael for everything that y'all have done, putting staff first. The concerns sounds like from last year, this year, it's been taken care of. I can't speak for myself, but I probably might be able to say this for all council. Staff comes first. It's without a staff, without happy people, we don't have a happy place to work, and we don't have employees. So just thank you all time. Thank you for everything that you've done. Thank you for being hopeful. But thank you all for trying to do the absolute best for our employees. Thank you.
I would just say it does sound like you all worked very hard at including all the department heads to reach out and hear and listen to our employees, which we never were not listening. But I think comes a point when you go that extra mile, which y'all have just done, and it does make a big difference. And it takes time. It takes a lot of time out of your regular day, and we have other additional challenges going on right now. So thank you all, because he's right. Staff is our priority and the backbone of our city. So thank you.
Ken?
Well, morning's changing really fast, lots of ways. And obviously, this is the screwing up system we have in the United States. So maybe not much help getting that fixed, but this is a step in the right direction to help keep costs under control, I think. And I appreciate everybody's hard work and getting this present with employees, and appreciate the employees' willingness to work and adapt, because it's sort of like necessary. So thanks to.
Yeah.
I will echo what Michael said about my personal beliefs that the healthcare industry, but health insurance industry, and that's pretty. Thank you for all your assistance and y'all's assistance and just as implemented. As a person who needs this benefit, so thank y'all for what you did, adults. And I do want to emphasize a statement you made about the increase in the ER. And using it for what it is, and I think just going there for samples is really important. So not going there for samples. So using it correctly, I think that's a good is the solution. Thank you.
If there's nothing else, I can adjourn the employee and the class workshop at 10:24.